Good Monday morning. Good Monday morning. This is Dr. Yonnette with another episode of Baby Talk. Happy Labor Day for those of you who are in the U.S. It's always a pleasure to join you. And today I want to talk with you on the topic of asthma in children. So let's get started. So, 1 in 12, about 6 million children in the US between the ages of 0 to 17 years have asthma. That's a staggering statistic. 50% of the children who have asthma have been hospitalized, but the hospitalization has declined from 10% in 2003 to about 5% in 2013. 1 in 2, or more than half of all the children with asthma, had one or more attacks in 2016. Now, this information that I'm sharing with you this morning comes from the CDC, so I want you to pay keen attention. And as we begin, I want you to think about journaling. Journaling, again, is going to be such a great guide for you if your child has asthma. So you may ask, what is asthma? Asthma is a serious disease that affects the lungs and results in wheezing, difficulty with breathing, and coughing. Over time, though, it can cause permanent damage to the lungs. And about 16% of black children and 7% of white children have asthma. Researchers don't quite know what causes asthma, but they know that to prevent asthma attacks, or at least make asthma less severe, there are certain strategies that you need to follow. Children with asthma and their caregivers are reporting that there are fewer asthma attacks and fewer days missed from school. But more children with asthma are learning how to control their asthma. That's the reason. And because of this, they are more available to participate in life. How are they controlling asthma? With an action plan. So let's talk a little more about what you can do. Your doctor, your pediatrician, the nurses, occupational therapists, physical therapists, your healthcare providers. You can teach your child and teach parents how to manage asthma by using a personalized action plan. And this action plan must be shared with all individuals who are involved in the care of the child. We can include community workers as well, such as pharmacists and other individuals who may interact with a child on a daily basis or on a regular basis. Now, you also want to assess your child's asthma. Assess your child's asthma. Make sure that the appropriate medications are prescribed and determine whether home health visits will help prevent attacks, because you want to prevent attacks. What's the problem here? Half of the children with asthma had one or more attacks in 2016, and the attacks are going down, but there are still many, way too many. Attacks have been affecting 50% of children in 2016, as I said earlier, but it occurs most frequently among children younger than 5. In 2016, children younger than 5 had asthma attacks. So new moms with infants and toddlers and preschoolers and kindergartners, and then we're going way up to high school. You need to take note and know the symptoms that you should look for. Now, the emergency department and urgent care centers that deal with has asthma attacks were found that the highest attacks were among children ages 0 to 4 years old and among non-Hispanic black children. So if you are falling into that group, you also need to take note. Now, here's what you need to be aware of. If your child's asthma is well controlled, then your child would have symptoms no more than 2 days a week. And these symptoms don't wake you from sleep more than 1 or 2 nights a month. That's a controlled asthma situation. If your child's asthma is controlled, then you can do all, or the child can do all their normal activities. And your child would have no more than 1 attack a year. That's showing that the asthma is controlled. No more than 1 attack a year that requires your child to take a pill or some liquid several days a week to treat the asthma. Also, you want to look to see for the peak flow. This is the measurement on how air moves in and out of your child's lungs. And if it doesn't drop below 80% of the child's personal best, then your child's asthma is controlled. And then finally, you need to take quick relief medication, no more than 2 days a week. You know, those puffs, then it means that your child's asthma is under control. Now, how do we deal with a medication? What medications are prescribed to prevent asthma? If your child, or you know of anyone who has asthma, you know they use an inhaler of a corticosteroids, and then there are other controlled medicines that are used to prevent asthma attack. You want to make sure you recruit inhalers, your rescue recruit. You want to make sure that you have rescue inhalers or nebulizers that can give quick relief symptoms of the symptoms that your child is having. But about half of children who are prescribed asthma control medications do not usually use them regularly. So moms and dads, healthcare workers, nurses, you want to ensure that if your child has asthma, he or she is using the prescribed medication regularly so that things don't get out of control and blow into an asthma attack. Okay, so what can be done to help your child with asthma? Education is the biggest thing. And the community around you, the government is giving lots of incentives for communities to take care of the education part of helping people know what to expect and what to do if your child has asthma. Now, education, like I said earlier, is so important. And moms and dads, you know where to go for education. There's tons of information that is available to you so that you are ensuring that your child is given the best option for success in school, at home, on the playground, and wherever he or she is. Remember, it's Labor Day. Take a moment to relax. Take a moment to take care of yourself. Do a skincare routine. Make yourself feel beautiful and special. And then take care of your baby. Make sure that your baby is getting the fresh, clean, crisp morning breeze or air to clean out his lungs and to help him to have a better quality of life. And you are doing the same as well. This is Dr. Yonnette coming to you again with Baby Talk, and thanking you for joining me this morning. extending to you a very happy Labor Day. Take some time for you as you take care of baby. I'll see you again tomorrow.